Have you ever had a C-section, or have you ever known anybody who's had a C-section that didn't need one? Today I'm going to talk to you guys about the C-section rate and some informed decision making and some ways that a woman can advocate for herself. In 1996, the C-section rate in America was under 18%. Over the course of the next 13 years, up to the year 2009, the C-section rate increased 60% up to 32.8%, meaning 1 in every 3 women in America was having a C-section. This percentage has actually stabilized at 31% for the last, since 2009. It's continued to stabilize at 31%. So we need to understand first and foremost about why women have C-sections. Of course, there's always the necessary medical reason that a woman should have a C-section, and there's also the women's elective C-section. Now we're seeing a lot more of that in our society. But primarily, 95% of the C-sections done in America are done because of a woman's failure to progress through labor. So a doctor has a standard of time that says the woman's body should perform at a certain level. If her body doesn't perform at that level, then they suggest surgical intervention. All of this is based off of a chart that was developed in 1955 by a physician by the last name of Friedman. And Friedman developed what we in today's society use as a normal labor curve. So if a woman doesn't meet those time frames that he set, then they're diagnosed with failure to progress, and they end up having a very major surgery because they didn't meet within the standard that was set 50 years ago. So I've attached the chart for you guys to review. Basically, it shows you that the most important part is that Friedman's study revealed that a woman should progress from 4 to 10 centimeters, or the active phase of labor, within 2 hours. Anybody who's ever had a baby knows that that's really not likely. So he set these time frames for this woman's progression to occur, and because she's not meeting these standards, physicians are recommending a cesarean section. In 2010, another physician named Zhang did another study on a much larger group of women, and during this study he was able to discover that 2 hours wasn't a normal time frame for a woman to progress through that active phase of labor. So I've also attached his chart for you to review. It's very interesting to see the difference between the two. One of the things Zhang discusses is that he shows that some of the medical interventions our physicians are offering us in the beginning stages of labor, like epidurals or other types of pain medications, or we all know that a woman has to stay laying in a bed in a hospital environment to have a baby. Those types of things are actually causing the natural birth cycle to slow down and for those time phases to lengthen. So when you talk about 95% of women in America having a C-section for failure to progress, and the physicians are measuring it off of a chart that was developed 50 years ago, I think that resolves back to a lack of education with our women. So it's important that any woman who's in a situation where they're preparing to have a baby, or a family member is preparing to have a baby, should educate themselves. Understand that those time frames are not developed in our society today. They were developed 50 years ago. Educate yourself and understand what your decisions are. Know the risks of having a C-section. Understand what informed decision making is. Research it and know what all your options are, and know what the benefits and the risks and all the outcome possibilities are for anything that you might choose. I encourage all women to do that and to take control of their health care. So in wrapping this up, if you guys need any additional information, you can go to DONA.org. It's the doula website. They have a lot of education on there. I've also attached a couple of links for some other websites on here that could be very beneficial for you if you need some further education.